The Michigan Poison and Drug Information Center presents Medication Misuse and Safety. There are no financial conflicts of interest associated with this presentation. Learning objectives for this presentation include defining medication misuse, informing adolescents and adults about the adverse effects and health risks of medication poisoning, and presenting strategies to prevent unintended medication exposures at home and elsewhere. Medication misuse happens when a person is unintentionally or accidentally exposed to medication, or when medication is intentionally used by the wrong individual or for an unsuitable purpose. Unintentional drug exposures occur accidentally and can affect individuals of any age, though young children are most commonly impacted. Key causes include improper medication storage, such as leaving bottles open or within reach of children. Child-resistant closures offer some protection. They are not child-proof. The visibility of medications, like spilled pills, increases access for small children and pets. Properly securing medications in original containers helps prevent misuse by providing clear usage instructions and precautions, thereby reducing the risk of accidental exposures. Using medication as prescribed and for its intended purpose is crucial for maintaining safety. The indications for medication use listed on both prescription and non-prescription drugs provide vital information for healthcare professionals and patients alike regarding their intended use. Any intended deviation from specified indications is considered to be intentional medication misuse. To guarantee that medications are used only by the individual for whom they are prescribed and solely for their recommended purpose, it is important to store them securely. Every year, poison centers throughout the United States and its territories manage over 2.2 million cases related to poisoning exposures. Calls about medications and drugs rank among the most frequent types of calls received daily at poison centers. Last year, pain relief medications, including over-the-counter, prescription, and illicit sources, were responsible for nearly 270,000 poison-related exposures. Other commonly reported drugs include antidepressants, antihistamines, heart medications, and mental health medications. Poison centers also received numerous calls regarding various other drugs involved in unexpected exposures. Over-the-counter or OTC pain relief medications are common in households, often used without professional guidance. Users should understand that different OTC pain relievers have varying effects and potential health risks. This slide lists popular OTC generic pain relievers and their brand names. Note that each generic may have multiple brands and can be combined with other medications as well. Over-the-counter medications are not universally safe for all situations or individuals. OTC pain relievers may relieve pain in different ways. If you are under the care of a healthcare provider or taking prescription medications, including those for pain relief, consult your prescribing physician or pharmacist before purchasing or using OTC pain relievers or any other OTC products. Just like prescription medications, OTC medications may pose risks when used in combination with other medications. Like over-the-counter pain relief medications, prescription pain relievers come in various forms. Many of these commonly prescribed medications are formulated in combination with standard OTC analgesics. This highlights the importance of informing your healthcare provider before using any medication that has not been specifically prescribed or recommended for your use. Although pain relief medications received special attention, the same safety precautions should be applied to all types of medications. Other examples of potential medication misuse is related to over-the-counter antihistamines. This issue will be explored in more detail in the Need to Know for Teens and Young Adult series. It is essential for parents and caregivers to securely store products containing diphenhydramine to prevent misuse by young people. Incorporate medication storage and safety into your overall household safety strategies. Medications that are prescribed or suggested by our healthcare professionals must not be shared with others. Our healthcare providers are familiar with our health history, medication allergies, and other factors that determine why specific medications are the most suitable for treating our health concerns. Using prescription medications and certain over-the-counter drugs without medical oversight can lead to serious and potentially life-threatening drug-related complications. Patients and caregivers must understand safe use and precautions for new medications prescribed by healthcare providers. Before leaving a facility, they should be informed about names and purposes of medications, precautions, storage and strength, correct administration amounts, timing for doses, steps if medication is ineffective, and actions for dosage errors. Consulting a pharmacist for further questions is recommended. If they are not available, call the Poison Helpline at 1-800-222-1222. A specialist in poison information can assist all callers at no cost around the clock and every day of the year. Prescription medication labels include instructions for proper use tailored to each patient. Key details on prescription labels include pharmacy name and contact information, prescribing doctor's name, patient's name and address, unique prescription numbers, dates for filling and discarding medication, drug names, generic and brand, dosage information, including strength and directions for use. Most pills also have imprint codes, which should be matched with the label. If there's a discrepancy, contact your pharmacy immediately. When preparing medication, follow these steps to avoid errors. Prepare the correct medication in a well-lit, distraction-free space. Carefully examine the label to confirm you are preparing the right medication for the intended person. Read the label before opening or preparing any medication. Double-check the patient's name and medication during preparation. Recheck the label before storing the medication to ensure accuracy. When managing medication for ourselves or others, it may be helpful to understand how medical professionals ensure they administer the right medication to the appropriate patient. Always verify the label for the correct patient. In healthcare settings, staff will check the patient's wristband and ask them to confirm their names and date of birth. While this may not seem necessary at home, it's important to remember that multiple household members might be prescribed the same medication. Confirm the drug name and read the label to make sure the correct route is used. Medications at home are usually packaged for easy preparation according to their intended method of administration. Pills are generally taken orally, while liquids can be swallowed, injected, or applied into eyes and ears. Ensure that medications are administered at the right time and in the appropriate dosage so the patient receives the correct amount. Most medications prescribed or recommended for small children are in liquid form. It's important to review all instructions before preparing and administering medication to children. Use the correct tool to measure medication precisely, ensuring accurate dosing. Liquid medications are typically measured in milliliters or ml, or fractions of an ml. For reference, 1 teaspoon equals 5 milliliters. Therefore, if the instructions indicate a dose of half teaspoon based on the child's age and weight, that equates to 2.5 milliliters per dose. We do not recommend using teaspoons or tablespoons from the kitchen for medication dosing. These spoons will not yield the accurate medication dose. Use a dosage dropper or dosage syringe to administer liquid medications. As seen in the photo, a 5 ml dosage syringe indicates how much medication to give in milliliters and parts of a teaspoon. If the medication includes a dropper or dosage cup, stick to using that device for administration. Administering medication to infants and small children can be challenging. Never force medication into a child's throat. When using a dropper or syringe, administer the medication slowly between the child's tongue and cheek. Dosage cups can vary in their measurements, but they typically hold 1 tablespoon or 15 mLs or 1 ounce, which is 30 mLs. Dosage cups are not advised for medication administration to infants or small children. When preparing liquid medication in a dosage cup, place it on a flat, even surface before pouring to ensure that dose aligns accurately with the measuring line. For any questions regarding correct measurements and dosing, please reach out to your pharmacist, healthcare provider, or the Michigan Poison and Drug Information Center for assistance. Parents should consult healthcare providers about when and how children can self-administer medication. Children should not take medication without understanding its purpose. Children must know how to respond to unexpected medication-related symptoms. Concerns about medication misuse require reassessment of a child's ability to manage their own medication. Parents and caregivers must inform school officials about medications needed during school hours, including obtaining consent and usage agreements. Managing medications can be overwhelming, so it's important to keep an updated record to prevent medication misuse. Recommendations include maintaining a comprehensive list of all medications and supplements that clearly state the purpose of each medication. Review medications during healthcare appointments and arrange an annual medication review with your primary care provider. And safely dispose of any unused or expired medications. There are many tools designed to help decrease medication misuse and dosage mistakes. The technology you choose may be based on cost considerations. Free medication dose reminder apps are available for smartphones and tablets. Additionally, pill organizers and other reminder devices can be used. Using apps and various devices to assist patients and caregivers can keep us on schedule with daily medications and prevent overuse. Speak with your healthcare provider or pharmacist for the most suitable options. Medication misuse often occurs at home, making it necessary to secure medications. We recommend the following for safe medication storage. Access should be limited to patients and caregivers. Keep medications in original containers to prevent errors. Use child-resistant closures correctly and ensure they are secured. Consider locking cabinets for safe storage of all household medications. Use lock bags or lock boxes inside a locking cabinet for added security. Opt for storage with combination locks to restrict access to only patients and their caregivers. Store medications away from high traffic areas and out of reach of children. Avoid bathrooms and kitchens due to temperature and moisture fluctuations that can affect medication efficacy. Medications should be kept at stable room temperatures unless refrigeration is specified. Place medications on high shelves and out of children's reach and above adult eye level. If using an unlocked cabinet, consider installing a lock or using a locking cabinet for added safety. When traveling, it's important to consider the use of medication on the go. If you store medication in personal items like purses, totes, or backpacks, make sure they are out of reach of small children, pets, and others. Keep these items off the floor and within sight of their owner. Ensure luggage is locked when not in use if it contains medication. We strongly advise parents and caregivers against storing their own or a child's medication in diaper bags, as infants and small children often explore the contents of these bags. Individuals on multiple medications often use pill organizers for proper dosage. It's recommended to choose a pill planner with a locking mechanism and store it securely when not in use to prevent accidental poisonings in children, as they may mistake it for a toy filled with candy. Maintain an accurate medication list of the pills in the organizer for healthcare access in emergency. Always keep pill planners locked and out of reach of others. Lock boxes and bags can easily be found for sale both online and in stores. If purchasing these items is not an option for you, consider reaching out to your pharmacy for an affordable complimentary program. Numerous human service agencies also offer free and low-cost tools aimed at preventing medication misuse. You can seek support from your local health department, community action agency, Veterans Affairs facilities, and drug-free community coalitions. Disposing of unused and expired medication the right way plays a key role in preventing unexpected drug use and ensuring household member safety. Medication-related incidents are the leading cause of poisonings in the U.S. Proper disposal of old and expired medications is necessary to prevent misuse. Recommended options for safe disposal include taking unused medications to drug take-back locations, such as the Michigan State Police, local police departments, specified pharmacies, and other healthcare organizations. Also, participating in the biannual DEA take-back days, and contacting your local public waste departments. As a last resort, drug deactivation kits may be available from local coalitions, which can render medication ineffective for safe disposal in trash. Drug take-back facilities are accessible across Michigan all year long. For links to drug disposal maps and resources, scan the QR code for the MIPDC Medication Safety page, or go to www.mipoisonhelp.org to locate the medication safety page there. Thank you for taking the time to learn about medication safety and misuse prevention. For more information and questions regarding medication safety, visit www.mipoisonhelp.org or call the Poison Helpline at 1-800-222-1222. For questions regarding drug exposures, dial extension 1 to speak with a specialist in poison information. For education inquiries, dial extension 2. Scan the QR code to provide feedback regarding this presentation. For updates and important notifications from the MIPDC, follow us on Facebook, Instagram, LinkedIn, X, and Blue Sky. For links to our socials, visit www.mipoisonhelp.org.